What is palliative care? A guide to understanding palliative care. Palliative care is a kind of support that helps people with life-threatening illnesses to be as well as possible and have better quality of life. It is most often provided by a team of doctors, nurses, social workers, chaplains, and other health professionals who share respWonsibility for your care. Palliative care also includes psychosocial support for you and your family. In this blog post, we will tell you what palliative care is and why it's important. We'll also answer some questions about the different forms of palliative care available to help you decide if it's right for you or someone close to you. Read on to learn more. The goal of palliative care is not to cure you, it's to improve your quality of life. Palliative care providers work together with your other doctors to help you get the best possible medical treatments while also supporting you by easing symptoms and side effects, such as pain or nausea, caused by the illness or its treatments. Why is palliative care important? Palliative care can be important for people with serious illnesses because it helps them feel better and enjoy life more. Palliative care is often provided by a team of doctors, nurses, social workers, chaplains, and other health professionals who share responsibility for your care. You may also get palliative care from a service provider like a hospice or long-term care facility. The goal of palliative care is to help you live as well as possible despite your illness. Palliative care can help people in different ways depending on the needs they have at the time. For example, if you are feeling agitated or anxious, your doctor may prescribe medication to help you relax. If you need physical therapy because the disease has caused pain and mobility problems, then that might be what your doctor prescribes for you. How do I know if someone has received palliative care? The main goal of palliative care is to help people with life-threatening illnesses. If someone receives palliative care and has a better quality of life, they may not need a cure for their illness. It's hard to tell if someone has received palliative care just by looking at them, but there are some signs that may signal that someone is receiving palliative care. They're no longer in pain or have symptoms of their illness. They have a better appetite. They're sleeping more comfortably. Their mood and outlook have improved. Their mental function improves. They aren't so tired all the time. Who can provide palliative care? Palliative care is usually provided by a team of doctors, nurses, social workers, chaplains, and other health professionals who share responsibility for your care. Do I need to be near death to receive palliative care? No, palliative care is for anyone who needs it. Some people may need to receive palliative care at a specific point in their illness, but others will need it for longer periods of time. What is the goal of receiving palliative care? Palliative care is not just about relieving symptoms, but also improving quality of life and providing psychosocial support. It is most often provided by a team that shares responsibility for your care. The goal of palliative care is to improve your quality of life while you are experiencing cancer or another serious illness, such as heart failure or severe arthritis. But it can also be used at any stage of the disease or illness. Can I receive palliative care at any age or stage in life? Palliative care can be provided to anyone at any age. Palliative care is appropriate for children and adults, as well as people with chronic or life-threatening illnesses. Who decides what type of end-of-life treatment a person will receive? A doctor, nurse, social worker, and chaplain will work together to decide what type of end-of-life treatment a person will receive. The decision is up to the patient or the person giving consent. Who decides on hospice care versus other treatments for the patient? Palliative care is for people with serious illnesses who are expected to live 6 months or less. Hospice care is a form of palliative care that offers intensive medical, nursing, and social work support from a team of professionals. Hospice care can be given in your home or in a hospice facility. A doctor will make the decision on whether hospice care is right for you based on your individual needs, prognosis, and other information, including what symptoms you're experiencing, how comfortable you are with the type of symptom control methods you're being offered, your age, your quality of life at this time, your family's wishes and goals for you. It takes the input from many people to work together to create the future. No one walks alone on their journey. With the help and effort of many disciplines, the quality of life desired will be obtained.